The Diabetic Foot, Preventing Loss and Amputation, a Pictorial Approach. I finished writing this book in 2019. I live in Southern California, and it's now approximately 10 weeks since the beginning of the COVID crisis. So I thought it would be beneficial, while I'm waiting for this book to be hopefully picked up by a publisher, to present the book to the public and possibly place it on YouTube. When one looks at the cover of the book, one notices that it's written in both English as well as Spanish. The picture on the front cover was created by an artist by the name of Roy Lichtenstein. He's a famous American contemporary artist who is known for almost cartoonish type of pictures with a very classical modern sense. This particular picture depicts a gentle hand applying medication to a foot. The word that should be emphasized is the word gentle. The diabetic foot requires gentle, careful evaluation and appropriate treatment. This care needs to be implemented by a specialist, preferably a podiatric foot and ankle surgeon who is trained specifically in the treatment protocols that are involved in treating this particular condition. I will not read all the pages verbatim, but the book does stress the fact that medicine is an art, and however, art is sometimes helpful to explain various problems that can affect our body. The book is dedicated to my parents, Martha and Benjamin Marcus, who have always encouraged their children to keep learning and to aspire to reach new goals. There's a foreword written by Dr. David G. Armstrong, who certainly is known throughout the world in regards to the treatment of the diabetic foot and ankle. He has generously written a foreword that is greatly appreciated. Why this book? Diabetes is a disease of epidemic proportions. Many diabetics are less informed about the disease than they deserve. They often have difficulty determining whether they truly have a complication or not. Many diabetics do not take care of themselves as they should. The purpose of this book is to help one improve the quality of their life and the quality of life of their loved ones. So please, please share this information with them. There is an expression, a picture is worth 1,000 words. I utilize this throughout the entire book. I do think that sometimes by looking at a picture, one learns more than reading 2 or 3 chapters on a subject, especially when topics are sometimes very difficult to accept. So what I did was I spent approximately 1.5 years with a graphic artist. I would send him literally hundreds of pictures of clinical problems, and he would modify them to a drawing, one that would be easier for the population to accept, yet at the same time graphic enough to act as a warning to hopefully prevent further complications from occurring. There are multiple facts that I could read to you with reference to diabetic problems. I will just give you some of them at this point. Every day, 5,000 people in the United States are diagnosed with diabetes. Every day, 200 limbs are amputated in the United States as a result of this disease. Every 20 seconds worldwide, a portion of a limb or a limb is lost as a result of this disease. Every day, 200 people in the United States will actually die as a result of this disease. The healthy foot. When your feet are healthy, they allow you to stand, walk, and run on various surfaces. Healthy feet help balance and support your skeleton. They feel the ground you walk on, and they adapt to various terrains. Healthy feet have adequate blood supply. Arteries are blood vessels that transport blood from your heart to other parts of your body. Arteries provide the blood that delivers essential nutrients and oxygen to all of the tissues of your feet. Healthy feet also have nerves that allow us to feel the ground you are touching. They also allow you to feel the difference between something that is sharp and something that is dull. Our feet are supposed to perceive sensation. If we step on something sharp, we should feel pain. If we touch something hot with our feet, we normally react by moving your feet away to prevent an injury. Healthy nerves allow us to feel the pain. The bone structure in a healthy foot allows us to stand upright and aids in our balance. Each foot is composed of 26 bones. 1/4 of the bones of the body are in your feet. Healthy feet properly accommodate the ground as we walk, stand, and run. They adjust to various surfaces. Bones provide structural support for your body. They allow us to walk in a normal gait pattern that involves a cycle of movements, enabling you to propel with a smooth heel-to-toe pattern. Peripheral arterial disease. As someone with diabetes, it is common to develop plaque-like changes in your arteries that result in reduced blood flow to your leg, feet, or toes. This is sometimes referred to as PAD, which stands for peripheral arterial disease. This condition prevents your body or part of your foot from receiving the nutrients it needs to stay healthy. Decreased blood supply is now occurring in the foot to our right. His 4th and 5th toes are showing signs of vascular disease. This may include color change, reduced temperature, and sometimes pain. Cramping pain when walking that goes away when you rest and returns when you walk again is also a common symptom of peripheral arterial disease. Diabetic peripheral neuropathy. As a diabetic, the ability to feel pain in your feet is often impaired. Your sensory nerves are likely damaged to some degree, resulting in reduced function. You may experience numbness, burning, or tingling in your feet and toes. You may lose the ability to sense the difference between sharp or dull and hot or cold. This patient's fourth and fifth toes are showing signs of nerve damage. This condition is called diabetic peripheral neuropathy. It is sometimes abbreviated and referred to as DPN. As a diabetic, you may lose the ability to feel something sharp. You may not be able to sense pain in your foot. If you step on something sharp, you may not be able to feel it. Your feet may be insensitive to temperature change. These are all signs of neuropathy, nerve damage, that can prevent you from being aware of serious problems in your feet. Charcot joint deformity. The drawing here shows structural bony changes that occurred from just a minimal amount of trauma. At first, the patient's foot appeared flatter and more swollen than his opposite foot. This was not painful to the patient. The condition is known as Charcot joint deformity. The condition can lead to collapse and fracturing of some joints of the foot, ankle, which would cause progressive swelling. Sometimes the arch of the foot completely collapses, which can lead to further deformity and inflammation. These patients all have some degree of neuropathy, which makes their feet insensitive to pain. However, their feet are warm to touch, both to the patient and to anyone who touches their feet. The condition is often progressive, which means it leads to further destruction and deformity. These pictures represent an advanced Charcot joint deformity. This frequently leads to the development of foot ulcerations that can become infected, which then may progress to even more serious problems, including limb loss. An ulcer is a small opening in the skin that can occur in any area of the foot or ankle. At first, it may only involve the outer layer of the skin and more superficial tissues. Because of neuropathy, you may not feel it happening. The earlier you seek medical attention, the better the outcome. I'm going to repeat that. The earlier you seek medical attention, the better the outcome. If the condition progresses, bacteria may infect the ulcer and the surrounding tissues. The ulcer enlarges. Because of neuropathy, you may not feel any pain. Again, the earlier you seek medical attention, the better the outcome. Further progression of the problem has now occurred. This causes infection to spread to deeper tissues, and eventually the bone could become infected. When bone becomes infected or destroyed, this condition is called osteomyelitis. As the infection worsens, the surrounding tissues lose their blood supply, and the toe may actually turn black. The area is lacking oxygen. This condition has progressed to a point where the patient's toe is no longer viable. The tissue has died. Gangrene has developed. This patient required an amputation of her gangrenous fifth toe. Certainly, a loss of a part of your body is very difficult to deal with. Patients generally go through a 5-stage process in order to psychologically deal with the aspect of loss or even amputation. This process involves denial, anger, bargaining, depression, and eventually acceptance. These 5 stages of grief were first introduced in the late 1960s by a Swiss psychiatrist, Elisabeth Kubler-Ross. In this case, the patient came to me with advanced gangrene in his little toe, as well as early vascular changes in his fourth toe. Further diabetic problems occurred, which resulted in loss of the fifth toe, and then progressive changes to the fourth toe. Eventually, progressive gangrene occurred to the fourth toe as well. This necessitated another amputation, again due to the progressive disease that occurred. This diabetic patient came to me with an infection and gangrene affecting her big toe. This is not an uncommon problem. This diabetic patient required an amputation of her big toe. This particular diabetic patient has extensive problems in his foot. An infection has spread throughout the skin, soft tissues, and bones. It then spread throughout most of his toes and the ball of the foot. Unfortunately, this patient required an amputation of all his toes and parts of his metatarsals. This is called a transmetatarsal amputation. Unfortunately, this is not uncommon. This patient suffered from extensive destruction of the entire front part of her foot. She needed a more extensive amputation. A significant portion of her foot was lost. This is called a show part amputation. Unfortunately, gangrene and infection have spread upwards towards this patient's ankle and lower leg. He required a below-knee amputation. Sadly, some diabetics have problems that end up in this situation. A goal of this book is to reduce the frequency of this. I've created a list, which I call my list of 26. You may say, why 26? Well, there are 26 bones, again, in the human foot. Number 1, no matter how minor you think the problem is, please seek medical attention as soon as possible. Number 2, take a look at your feet on a daily basis. If you can't see them, ask a partner, a friend, to do it. Use a mirror if you have to see the bottom of your feet. but check your feet daily. If you see something that's abnormal, go to the doctor. Again, because of neuropathy, don't wait to feel pain. You may never feel pain. Number 3, please do not self-diagnose your problem. Go to a foot specialist. Let him or her do that as soon as possible. Number 4, be aware of your neuropathy. Remember, you could have an infection full-blown in your foot, and you may not even feel it. Number 5, again, be aware of your neuropathy. Am I repeating that? Yes, I am. Why? Because it is the neuropathy that sometimes causes patients to stall from seeking medical attention. Number 6, all diabetics are prone to foot problems. Whether you take oral medications, whether a physician tells you you're a diabetic and you're just diet controlled, or whether you're on insulin, all diabetics could have foot problems. Number 7, ensure that your diabetes and other medical conditions are monitored properly and promptly. Take good care of your disease. Number 8, take all of your prescribed medications as directed. There's a reason they were prescribed. Number 9, if you're overweight, lose weight. Number 10, control your diet. Don't let your diet control you. Pay attention to the foods you eat. Fast foods are generally not healthy. Avoid sugars. Avoid sodas. Number 11, stay away from drinking sodas. They're full of sugar. Also, avoid fruit juices. They are full of sugar. Number 12, please stop drinking excess alcohol. This includes beer. Alcohol and diabetes don't mix. Number 13, exercise. Exercise. Discuss this with your doctor to determine the best type of exercise for you. Number 14, stop smoking. Do not smoke. Get rid of your cigarettes. Don't even think about it. Number 15, if you have an addiction to alcohol or drugs, please be aware that this often causes very serious complications for the diabetic. I consider this simply as pouring a can of gasoline into a blazing fire. Number 16, do not go barefoot, even at the beach. I'll repeat that one. Do not go barefoot, even at the beach. Number 17, always wear appropriate shoes, insoles, and socks. Number 18, gradually break in shoes. Number 19, if specialized diabetic shoes and insoles are prescribed, wear them. Don't keep them in the closet, not used. Number 20, if you're given a brace, a postoperative shoe, or a walking boot for your problem, use them as prescribed. Number 21, inspect the inside of your shoes before you put them on. Number 22, do not bathe your foot in hot water. Lukewarm water is preferred. You may not feel that the water is hot, and you could literally burn yourself. Number 23, if you see a problem developing, do not assume that it will go away on its own. Seek immediate medical attention. Number 24, If you are instructed to be non-weight bearing, this means absolutely no weight should be applied to your foot or ankle. No walking, no standing. Number 25. Please follow up as directed with all of your medical appointments. This allows proper treatment for your condition. Number 26, regular observation of your feet by a podiatric foot and ankle surgeon often leads to reduced complications. Diabetes affects multiple organs. Although this book has focused on the problems that you might experience in your feet and legs, please be aware that diabetes can affect many parts of your body. People with diabetes often develop a condition known as retinopathy, which can lead to reduced eyesight and even blindness. Diabetics also have increased rates of heart disease, leading to coronary artery disease and heart attacks. Reduced kidney function, which may lead to the need for dialysis or even kidney transplant, is also an issue for some diabetics. It is my hope that this book has increased your awareness of some of the potential complications of this disease, and that you understand why the diabetic foot is at risk. My wish is that this book encourages you to be more involved in your quest to improve your health. If this book helps prevent a partial amputation or even a single loss of a limb, then I have accomplished my goal. The picture to your right, which depicts the word cure, has been painted by a very famous contemporary artist by the name of Shepard Fairey. He has given us permission to utilize this in our book. Though at present there is no remedy for this disease, hopefully with continued research, we will soon discover a cure. Meanwhile, there is a lot that we can do to improve the quality of your life as you actively participate in the management of this disease.